Hi, I'm Dr. Sarah Candler. I'm a primary care physician in Houston, Texas, and I'm here with Internal Medicine News to talk about social determinants of health. I'm going to introduce a couple folks who are here with me today.
Hi, I'm Elizabeth Porman. I'm a physician in Seattle.
And hi, I'm Horace DeLisser. I'm the Associate Dean for Professionalism and Humanism at the Perelman School of Medicine at the University of Pennsylvania.
Thanks for coming, y'all. We're here at ACP National at our meeting in Philadelphia, and we're going to talk about social determinants of health, which I know y'all are very familiar with. These are things that affect how we live, learn, work, and play. Both of y'all come from very different perspectives of social determinants of health. I think I'd like to start with Dr. DeLisser. Tell us more about your role at the University of Pennsylvania teaching about social determinants of health.
So in my role as the Associate Dean for Professionalism and Humanism, I focus on a number of issues, including social medicine, cultural competency, cultural humility. We look at healthcare disparities and try to do a lot of innovation around service learning that will bring our students into the community, one, to learn about these determinants, but more importantly, to be able to see how these issues can be addressed both on a provider level, but also on a more structural, systemic level.
Tell us more about service learning, because that's not a typical thing that everybody does in medical school.
We first of all encourage our students to be involved in a number of student-led clinics and programs that service the West Philadelphia community, both in terms of providing medical care as well as various social services. So we provide administrative as well as financial support as well as training. In addition, we've been developing a number of other innovative programs and courses that allow our students to, again, get exposure to these determinants, but more importantly, see ways that they can truly be addressed. So one thing that we have developed is a rotation where senior medical students are able to actually serve as apprentices to community health workers that the health system pays for. And in this role, the students are actually serving as apprentices where they're learning from these community health workers. And the community health workers actually grade them and really supervise them. So in many ways, it serves as a reversal of the power dynamic that normally entails in that kind of situation. So that's just one example of some of the things that we're innovating.
That's really interesting. I know American College of Physicians came out with a position paper this time last year at the internal medicine meeting about social determinants of health, and one of the biggest priorities there was trying to encourage educational institutions to figure out better ways to teach this stuff. And I think you're exactly right. I think being on the ground in the space where these things are happening is the best way to learn. We know that that's true of medicine, that we see one, do one, teach one, right? And I think you're exactly right. It sounds like some great things are happening at Penn. I want to ask one more follow-up question to that. When you say that you're giving them training, what kinds of things do you teach medical students to prepare them for that?
So specifically in terms of the students' participation in community health and in our community clinics, we provide training in terms of motivational interviewing, training about handling psychiatric emergencies. We also provide some basic skills training in terms of taking a physical examination and taking a history in that setting. And then we also encourage students who are participating in those programs to take a number of other supplemental optional courses that we have that can further prepare them to serve well in those settings.
You mentioned you give them supplemental training, these students who go out to do service learning projects. What kinds of topics are you teaching them? Because I know some people are concerned that teaching social determinants of health or having people shadow a community health worker, quote, isn't a doctor's job. And I know there's pushback there. So what kinds of things have the University of Pennsylvania decided are important skills for these students to have?
Well, I think on one level, it's very important to be able to communicate in a relational way, to be able to convey respect, foster trust, and create a sense of alliance and partnership with your patient. We also try to do a lot of interprofessional education because a lot of community engagement really does involve other disciplines and other providers, whether it be nursing, whether it be social work, pastoral care. I mean, all those other disciplines, I think contribute very meaningfully to doing appropriate community engagement.
Learning how to work with patients who are hesitant to open up to a professional like a physician are all skills that we would need in any doctoring situation. I think that absolutely, it sounds like you've picked all the right skills, but you're exactly right. It sounds like patients who suffer from social determinants of health affecting their ability to stay and get and stay healthy are absolutely the right ones. We need to figure out how to communicate with people and meet where they are.
And I think to that I would add that we do a lot of work in the general curriculum around self-awareness, reflection, thinking about things like implicit bias. So in addition to kind of the things that we provide specifically for those students who are engaged in that work, we also kind of provide that more general education, I think, in terms of the self-awareness and becoming just better attuned to one's own personal biases.
I think you're exactly right. I'm really excited to hear that Pennsylvania is doing that. I'd like to move to Dr. Alyssa Poorman. Dr. Poorman, tell me more. You actually practice in some of these settings with patients who really struggle with social determinants of health. I know that there are lots of different populations that you've worked with in the past. What are some of those things that affect how patients live, learn, work, and play that have affected how you can take care of your patients best?
I think I want to pick up on a lot of things that Dr. Delisser was saying, particularly this idea of cultural humility, which is a term that I heard a while ago and I really love because I think it overlaps with how I think about medical education and what's traditionally been missing in medical education, particularly in what we call the hidden curriculum. I'll tell you a story. When I was in medical school, I did the Migrant Workers Farm Project. We set up tents in fields where many migrant workers were, and would see hundreds of patients as a group. It was wonderful, and it was actually a physician assistant run program, which, to your point about communication and interprofessional communication, was invaluable. But I remember very distinctly a woman coming in with terrible back pain, and she was showing me the motion that she did while picking corn. And I said, okay, well, you have to, kind of switch it up. If you're constantly doing one side, it's going to hurt. And she kept trying to tell me that's not an option. And I just I wasn't listening. And the next day, they actually brought us to pick corn. And she was on this giant machine that was running through the fields, doing the motion that she showed me. And I realized what actually was happening. And it wasn't like she was out in the fields picking. She was really turning her body kind of into part of a machine. And she did not have control. So the advice that I was giving her was not helpful, and it wasn't compassionate to the environment she was in. And I remember her looking at me like, mm-hmm. And
now you know.
Now you know. And I try to really keep that in mind. And of course, constantly making mistakes. But that's a very powerful example of cultural humility to me. And I also remember thinking, man, we must have been out here for hours. And I looked down at my watch and it had been 20 minutes. So I just have tremendous gratitude and respect for the people that pick our food. And then in terms of the power dynamics, many of my patients don't speak English. I try to make a huge effort to learn at least, hi, how are you? I'm your physician, in their language, and thank you. And generally, I boggle it, but they see the effort. And for that moment, it switches the power dynamic. So I'm trying really hard to speak their language as opposed to them being feeling upset and sometimes even ashamed that they can't speak English. So I think that's really important. And then as far as service, I think so many of us go into medicine for service reasons, and something happens in medical education, and I think that takes it out of us. And I think that's something that as a culture and as a profession, we've sort of been unwilling to confront and admit and talk about. But beginning in medical school, and particularly in residency, you see a drop in empathy and a rise in cynicism. And I think that your focus on self-awareness is not even only so important for us to recognize our blind spots, particularly if we can't relate to the experiences of our patients, but also to check in with ourselves emotionally and to make sure that we're healthy, we're able to stay vulnerable, we're able to stay connected and open and humble with our patients.
Those are great points and great examples. Clearly, there are lots of things that affect how our patients get and stay healthy. These things we call social determinants of health, things that affect how we and our patients live, learn, work, and play. I'm excited to know that ACP actually has a bunch of resources that can help us learn more for ourselves and also teach some of our trainees or our colleagues. We know that it's not something we can do alone. ACP has a couple of resources for specific populations. I know that they've just come out with a great resource on treating patients who may be victims of human trafficking. They have policies on taking care of patients who are transgender. We have strong policies and resources about how to work in a team, because this is not, as I said, something that we can do by ourselves. And the best way to battle some of the moral injury and burnout that some of us face when we're taking care of patients who have these kinds of struggles, because it's hard, some of those resources actually, we have found, are best used in a team. When you're not the only person doing those things, then it becomes much easier to take care of somebody who really, really needs you. So thanks for joining us here at the American College of Physicians Internal Medicine meeting in 2019 here in Philadelphia.